Hi, my name is Samuel Hickson,
And I'm Alexis Baker.
and we are students at Northeastern State University studying in the field of social work. And we are working on a project for our senior seminar course, and we have an exciting topic we'd like to discuss today.
Yes, so we have actually decided to study something a little bit different, something that's relatively new to the field of social work, and that topic is moral injury. It appeared for the first time in around 2011, so we are excited to share about it.
That's right, and moral injury is a conceptual term for a type of trauma that's first recognized in active duty service members, as well as veterans. And as research into post-traumatic stress disorder increased over the past couple decades, that's when this topic began to show up a lot more in psychological and psychiatric research. However, recently it started to spill over into social work research as well, and not based on just service members and veterans alone, but on any professionals in the helping fields like social work.
Right. While this research was primarily focused on the military, it has now switched over to helping professionals in what researchers call morally complex situations. Doctors also experience moral injury and this type of trauma, and they may not even recognize it.
Which is why, as workers in the helping field, we actually both intern at the same agency in different departments. We wanted to talk about how we are at risk and how other people that we work with in our field are at risk as well. So we're going to go over trauma that social workers experience in the workplace today, and we are also going to kind of go over some scenarios and see whether or not the type of trauma we're describing would be moral injury. We'll end on a positive note and kind of go over some of the types of therapy used for moral injury and self-care for helping professionals. Alright, so a common definition for moral injury that has been defined by the Disabled American Veterans, this 2019 definition is: moral injury is when someone feels they have violated their conscious or moral compass when they take part in, witness, or fail to prevent an act that disobeys their own moral values or personal principles.
Okay, so another definition is that moral injury may occur when there is a troubling mismatch between the individual's core moral beliefs and the event. So now that we've looked at the definitions of moral injury, it's important to look at who experiences moral injury. Like we said, it initially started off with describing combat veterans, but it has extended into other individuals such as physicians, social workers, teachers, firefighters, those living in poverty, those struggling with addiction.
So essentially, anyone is susceptible to moral injury if they are in a morally complex environment. In that case, I'd like to transition into kind of talking about, at least in our internships, what we've kind of seen that could be considered morally injurious in other social workers, or that we could experience any situations that you might know of that we could experience something like this.
Mm-hmm. So a lot of the research says that child welfare workers experience extremely high levels of moral injury, and these experiences come from both acting and not acting. So, for example, a child welfare worker has to remove a child from a home. That would be morally injurious because it may go against their core values. On the other hand, if they fail to remove a child from a home, possibly just because of agency restrictions, that's also morally injurious because of failure to act.
And that's not to say that anyone who is a child welfare worker or anyone else who works in morally complex environments necessarily will feel any of the symptoms of moral injury, which we will go into for taking part in these kinds of home visits, especially, or any of these typical social work roles. Part of moral injury and why it is so pervasive is the fact that this is something that is very personal. When dealing with personality matters it can manifest in a lot of different ways, and a lot of times we don't recognize that we've started carrying around a lot of guilt about something that we've experienced or even just witnessed as social workers.
Right. And this is going to transition into looking at the difference between PTSD and moral injury. So it is commonly confused with PTSD because they do present similarly. Okay, so the difference between PTSD and moral injury is that PTSD has more of the startle reflex, memory loss, intense fear, visual and auditory flashbacks, feelings of safety is lost, and fear of a perceived or real immediate threat. Whereas on the other hand, moral injury is more of the psychological effects of trauma, such as sorrow, grief, regret, shame, alienation, feeling of trust in self is lost, and it can occur without an immediate threat.
That's right. I'd like to go into that, like the toxic shame is what I think typically we refer to it in psychology and social work, is when a lot of times we witness these events, and toxic shame would be when we feel guilty over something we really had no control over, which can still be a moral injury even if we just witness something and don't have control over it, which happens quite a bit in our field. I'd say that comparing back to child welfare workers, any other populations we work with, I mean, even homeless, substance abusers, there's various situations in which we can witness things that kind of go against our own personal belief system, our morals, and it's just witnessing an event and kind of carrying around those feelings that it brings without acknowledging why we're feeling them.
Right, and then that's also why it's important to discuss compassion fatigue. A lot of us enter the field of social work because of personal experiences. These are great in giving us empathy and allowing us to connect with our clients, but they can also, on the other hand, be harmful because it brings us too close. And we start to experience that fatigue where we feel like we can't give any more to our clients.
Which is interesting because I know, at least in my schooling through social work, the kind of trauma we talked about affecting us as workers has been like vicarious and secondary trauma, which in that case causes compassion fatigue and sometimes burnout from, usually I would say that we've talked about it in like therapy settings where a therapist sees a client and the client maybe has gone through a lot of similar things to them, as far as like the therapist and the client, which can bring back some like countertransference of the therapist starting to kind of relive their own trauma, or even just hearing some experiences from clients and that alone being traumatizing.
Right.
And then going back to home visits, I mean, you can go into a home and kind of witness even more and bring in more of the experience of someone's life, and that can be traumatizing. But that's a lot different than moral injury a lot of times, because you can experience that kind of trauma without having anything either you witnessed or have taken part in that transgresses any of your own moral values.
Right. And it's also important for us to look at how PTSD and moral injury are similar. So they present similarly both with anger, depression, helplessness, anxiety, insomnia, nightmares, and self-medicating. According to the Research Quarterly, although PTSD and moral injury present similarly, not all people affected with PTSD experience moral injury, and on the other hand, not all people with moral injury end up experiencing PTSD.
Mm-hmm.
It is often said that prolonged moral injury can lead to PTSD in helping professionals.
That's right, and I think it's really interesting how the research has began showing up a lot now of moral injury. Even, it started with PTSD and our active service members and veterans, which was very much needed research, and it's great to see how much we've developed with that in the past couple decades. And now it's nice to see that moral injury is being researched kind of in the same way. Hopefully we see a lot more with it soon. I think it's, in the case of at least veterans, I think it's very gratifying for there to be another kind of trauma acknowledged clinically, where they're still experiencing a lot of pain and emotional distress, but not necessarily the types of symptoms that PTSD has with the hallucinations, the flashbacks. They may feel, those with moral injury rather than PTSD may feel that they don't have any recognition for what they've gone through, as it is more pervasive. And I think that hopefully this brings a new kind of topic to the table that therapists can start looking at when working with veteran clients.
Right. And so we see how far-reaching moral injury can be, and it does have those long-lasting psychological effects, and it affects every single aspect of life. You know, if you have moral injury, you're not able to successfully work with your clients. You probably aren't maintaining healthy relationships with your friends and family. You are self-medicating, and you're avoiding addressing that trauma because it is so painful. That moral injury is so hard to identify as well.
Mm-hmm.
And so it is important to learn how to identify moral injury in yourself.
Absolutely. Okay, so now we'd like to transition a little into identifying moral injury in ourselves. It's kind of hard. So this is going to be where we start talking about how do we both diagnose this in ourselves, kind of see it in clients too, and then going into self-care, we'll cover some topics on how self-care can alleviate some of the symptoms of moral injury.
Right, and it is important to note as well that moral injury does not have a diagnosis, whereas PTSD does. So while they are similar, you really do have to be able to identify moral injury in yourself because you can't go to a professional and have it diagnosed for you.
Mm-hmm.
So these are some ways that you identify that moral injury. And these are feelings that vary in intensity over time. People who have reported moral injury have said that they went through periods where it was very intense and then times where they were living a productive and what felt like everyday normal life. But they had those ups and downs of feelings of intrusive memories, loss of meaning, self-sabotaging, ongoing guilt, shame surrounding the event or several events, isolation, despair, and depression. And so I think it's also important to talk about just because you're a professional helper doesn't mean you can't reach out to others.
Mm-hmm. And you made an important point on how moral injury at the moment stands as kind of a theoretical concept. So it's, and another interesting thing that a lot of the research calls it is kind of a spiritual affliction because it is our personality, our morals, which is so personal, and to have something transgress that can manifest in different ways in other people. But the kind of route they're taking on, I don't know if it'll ever make it into the DSM, but as far as treatments that are being utilized in cases where moral injury is being studied are types of exposure therapy, which I'm not a clinician, so I'm not really familiar with a lot of the aspects of it, but from what I understand, a lot of the exposure therapy consists of a therapy session in which the client, which could be the helping professional in our case, the client is working with the therapist and confronting the event or events that caused the moral injury, which, you know, confronting trauma in therapy I know is a very difficult thing to do, to keep the reins on that kind of conversation as a therapist. So exposure therapy, I know that they use it in grief therapy too, where I know it's common for therapists who are working with those who've recently lost a loved one to do like the empty chair technique. I don't know if you've heard of that one, where, and I think it is actually used in movies because it's a little bit dramatic sometimes, but where you have your client speak to an empty chair as if they're speaking to the person that they've lost, which can be a very moving experience for the client if it's handled correctly. So just that's the type of exposure therapy, just for an example of kind of the route that you have to take for moral injury. So exposure therapy, and of course in combination with our normal cognitive behavioral therapy, CBT, are being studied with moral injury to kind of see if we can see any results, and hopefully we do.
Right, and they also say that group therapy is very effective in treating moral injury. So as we discussed earlier, there's a sharp influx of agencies that are now doing groups to address moral injury. And so rather than having a normal meeting during the workday, people are meeting once a week with their coworkers to talk about the moral injury that they have developed over the years and how they're addressing it in their personal lives, and any techniques that they can share with each other, because we all know whenever you have someone who's gone through a similar experience, it's so much easier to talk about those feelings and really get them out in the open.
Mm. Yeah, which that's why, a lot of substance abuse counselors have experienced addiction in the past. That goes back into that, and group therapy is really good for those in recovery. I mean, as has been evidenced by, AA meetings for years now, that's been a very common treatment, or I wouldn't say treatment, but a coping mechanism for recovering alcoholics. And then, of course, we have NA for narcotics addicts who are in recovery. So that's really interesting to see that the group therapy is a very powerful type of therapy, and I think that moral injury is going to be one where it'll be utilized a lot, even though it is a very personal affliction, moral injury, and each person can have a different experience with trauma. But I think those who have experienced a lot of trauma working with groups to kind of see the similarities that they're going with other people, and not being isolated, which is one of the symptoms, kind of getting rid of that isolation can be very beneficial and therapeutic.
Right, and that's why it's also important to transition into taking care of moral injury on a personal level with self-care. So some of those techniques are breath focus, and I have heard of this technique being where you set an alarm on your phone to go off every once an hour, roughly, and when that alarm goes off, you set a timer for 2 minutes, and in those 2 minutes, you close your eyes and just breathe deeply. And when those 2 minutes are up, your heart rate will be slowed, your anxiety will be alleviated, even just momentarily. But I have heard that that's very helpful. That's relatively new as well. So, and then we also have the body scan technique, and that's where you start at the very base with your toes, and you just focus on kind of getting every single part of your body in motion and kind of tuning it all together. So wiggling your toes, bouncing your legs, and then wiggling in the middle and moving your arms, moving your fingers, rolling your neck, and just kind of getting everything in check for a minute.
Mm-hmm. And while we're watching videos, I think YouTube has some very good examples of how to do some of these techniques, relaxation. Another thing that has been utilized a lot recently, we've talked about it a lot in school, I know I've talked about it at my practicum site, is the use of apps to help with, keeping yourself in check, whether just keeping your calendar right, or a lot of people who have conditions like ADHD, there's apps for that. We've got the Calm app for relaxation. We have pill reminder apps. We've had a lot of great things come out for our clients that I've seen utilized a lot in my practicum site. So that's exciting to see how technology's playing an important part in self-care now. So.
Right, and there's also those guided imagery techniques where it's so easy to get those, whether it be through podcasts or YouTube or an app. There's really no reason not to do it. And so then we get into kind of the more difficult things of like taking a short walk. I know that can be difficult during the workday whenever you feel like you have so much going on, but it's about taking a minute for yourself.
All right, and you know what another part of self-care is that I don't do very well is the nutritious meals and sleep. Um, you know, and we talk about it a lot, it's kind of a cliche at this point that eating healthy and getting at least 8 hours of sleep a night, uh, I say at least, keep it towards 8 and not a whole lot. But getting 8 hours of sleep a night is extremely beneficial to not only our physical health but our mental health as well. Even alleviating anxiety, increasing focus and attention. So that alone is very important. Alright, so yeah, just eat well, get the right amount of sleep. Another really important thing for me, and I imagine for a lot of people, especially in the helping field, you know, we go in with the empathy and wanting to help people. Learning to say no when you need to. I know that can be really difficult, but we've got to be able to say no to taking on more tasks than we can handle, whether it be in our home life, at work, school for us. It's very important to keep a check on both your tasks in your work life and home life, in our field especially. I mean, as hard as it is to acknowledge and tell our supervisors that we're working on too much, we have to do it for our own self-care. We don't want to burn out from being overworked, because we have so many other things that we can experience burnout from, of the compassion fatigue, of giving too much, and then we've got moral injury, of seeing things that we don't feel are right. So making sure that we keep our tasks and everything we're working on in a reasonable range to the best of our ability, I think, is a super important one. Let's see. And another one that we have that you suggested was pampering yourself. What do you suggest, Alexis?
So when people imagine pampering yourself, I think they imagine some crazy spa day where they kind of just go all out, when in reality it can be something as simple as doing your nails in the evening, or reading a chapter of your favorite book, or doing a face mask for 5 minutes. And pampering yourself even comes down to getting enough sleep and eating nutritious meals. You know, there's no big science behind it. It's just about doing things that you're happy doing and that make you feel good.
Yep, I definitely agree with that. Reading is one of my favorite things to do. So, I mean, even that, I know that one thing that I do that is part of my self-care that a lot of people find weird is cleaning. I love organizing my stuff. If I have a messy environment, feel like my mind's that way as well. I think a lot of people experience that. So that's one of the things I do, is just kind of keep organized, both in down to my paperwork to just how I keep my house. So got that one. And then hobbies are really important, which I know that we kind of had that ingrained as, you know, even back in school, like primary school, where we have clubs and, you know, people are in band or do sports, and it's important to kind of try to find things that you like to do as an adult and a helping professional.
Right.
And the little bit of time that we do have, I mean, hobbies can oftentimes be social, which is very important, as we've discussed, for combating any kind of moral injury or any of the things that we've talked about trauma-wise that cause isolation. Trying to not fall into that isolation and be by yourself all the time is a very, very good way to maybe not heal yourself completely from some of the pain and trauma that we go through, but maybe it's a way to get help. Maybe someone will notice something, or, you know, we talked about how moral injury, a lot of times people experience this and all of a sudden people have depression or start feeling guilty and don't remember what it was from, and it's partly because of something they experienced that's a moral injury from work.
Right.
So engaging, talking with people, and therapy, if it comes down to it. There's no shame in our field of having our own therapists. I know a lot of people that I've worked with in my practicum site so far have told me that they utilize therapy services, so there's no shame in that. A lot of agencies too, I know that ours does, have employee assistance programs where they actually will fund therapy services for you. I mean, at least a certain amount per year. So I would definitely say take advantage of that. If you have that opportunity, take advantage of that. Let's see, do you have any more, Alexis? Any more that you personally do to maintain self-care?
Honestly, my favorite thing is reading, but at the end of the day, I think it's really easy as working adults not to have a hobby and not to have an outlet, and to just go home and lay on the couch and go to bed. But those self-care techniques are so important in addressing that moral injury.
Mm-hmm. Ooh, another thing that I want to make sure we get in our presentation today is moral injury comes sometimes from witnessing an event. And this is one of the harder things about our field that, we talk about in classes, we read about, and it's part of our ethics as social workers, is identifying when an ethical violation has occurred, or even if you don't know for sure it has, if we've got if a HIPAA violation has occurred. If you see something in your work or practicum and it's not right or have doubts about it, definitely bring it up with a supervisor and don't just let it slide.
Mm-hmm.
I've heard a lot of stories about where people have seen something happen or something their coworker has done, even people who are above them, like different positions, have seen something occur that was actually an ethical violation and it's come back to bite them later.
Right.
Not only in the fact that a lot of times people feel guilty for it, but for the fact that some kind of harm happened to a client or someone else in a workplace because that ethical violation wasn't addressed at the time. So as difficult as it is, and I'm sure we'll run into that at some point in our working lives,
Mm-hmm.
definitely confront any ethical violations or even just suspected ethical violations with your supervisors at your agency or work. Always keep up to date with your agency's policies. It's a big one because sometimes they're different than our national sets of ethics and things like that. So keeping in check with that, making sure that we know what our agency expects from us, what our field or profession as social workers expects from us, is very important as well. Get off my soapbox there about that.
So, at the end of this presentation, I think it's most important to know that you have resources to recognize that moral injury in yourself and that you don't have to suffer with it silently. It is something you can share with others. It's something that you can work through. Do you have anything else to add, Sam?
Yeah, I don't think we talked about it quite as much. We talked about moral injury. This all started with veterans and service members. But this is something that can affect anyone in these environments. I mean, you can be a front desk specialist at an agency and experience moral injury. You can be custodial staff, paraprofessionals, anyone who works in a morally complex environment has a chance of undergoing some trauma, and we have to make sure that we're all prepared and prepared to recognize it in other people too. I know that a lot of times we can tell when our coworkers, our friends, our family are going through something, so it's important to ask as well. We have to ask our coworkers and everyone that we work with now as interns, make sure everyone's okay, check in. Which another thing about that is, as far as we spoke about group therapy for moral injury, but I know that you were talking earlier about how it's important for the staff of an agency or workplace to address these kinds of things, as far as you said, like meetings, I think, and advisory meetings with...
Right, so I think some of the most helpful techniques in group therapy in the workplace have been like the shame resiliency model from Brene Brown. It's a curriculum that helps prevent shame from anyone who has been through any traumatic event, and moral injury is grouped in with that. So I think that's important, along with talking with your supervisor about what's going on, what they can do to help, because at the end of the day, there's usually something that you're just not seeing if you will just ask for it.
Yeah, I think that's important, and I'm lucky enough, I know in my site that I work in, we have meetings all the time, and everyone else in my building, even with their respective departments, they all meet sometimes weekly. I know that we have a lot of people in our agency who are trauma therapists, and they go through a ton of training on self-care, checking in from the supervisors, and maintaining a lot of support because they deal with a lot of really hard stuff. So it's great to see that places take that initiative to acknowledge that their workers are going to see some things that are going to be hard to deal with.
Mm-hmm. I completely agree.
Well, I think that we've talked about everything that we'd like to go over today. So right now we should have our references that we're citing up on the screen. I would encourage everyone to research this topic as much as possible. We provided some links on some of them, I think. Some of them you can get to without having a university account to get into. But definitely keep up with this topic. I think it's going to be big coming up soon. I think that we're going to have a lot more research into this and hopefully a lot more treatments.
I agree.
And finally, I'd like to give a thank you to Dr. Laney Endicott from ORU, Oral Roberts University here near us.
Mm-hmm.
I don't believe he works there now. I think he's retired, but he actually led a workshop on caring for the clinician, a self-care workshop for, I don't know if it was both like case managers and therapists, but I think it was like all staff were able to attend. But it did have a focus on clinicians who work with clients who are experiencing trauma. But that workshop that took place in 2017 is what actually introduced me to the topic of moral injury because I didn't know much about it. So I'd like to give a thank you to him for bringing that topic up, and he was a little bit ahead of the curve because I know that a lot of this research we've looked up has been even more recent than 2017.
Yes.
So I'd like to give a thank you to him for inspiring our discussion. All right, well, with that, I'd like to thank you to all the viewers.
Yes.
Leave some comments if you have any interesting scenarios, cases, or any more research that we could look into on this topic or opinions as well. It's been great talking with you today, Alexis.
Yes.
I'm really excited we got to share this topic with everyone.
Thank you.